Hello friends, so we are back with a new topic, and our today's topic is traumatic injuries to the primary or permanent teeth. Trauma can occur in primary dentition as well as in permanent dentition. The prevalence of trauma in primary dentition is 11 to 30%, whereas the prevalence in case of permanent teeth is 5 to 29%. Trauma occurs most commonly in the male as compared to the female, and the age which is most prone to traumatic injury is 2 to 4 years in male, where the facial injury is very common, and in female it is 9 to 10 years. The most common teeth involved in facial injury is upper central incisor, and the prevalence rate is 37%. In case of primary dentition, the most common traumatic injury is luxation, and in case of permanent teeth, the most common traumatic injury is uncomplicated crown fracture. Trauma to the tooth can occur during the fall from the bike or the bicycle, or blow to the dentition, or any kind of fight, violence, or domestic injuries. Trauma around 2 to 3 years is common because at that time motor coordination is developing and the child start moving around on their own. Now coming to the Ellis and Dewey classification of traumatic injuries. Ellis and Dewey in 1960 gave the classification of traumatic injuries. They classified the injuries into 9 classes from class 1 to 9, and it is in Roman number. This is the pictorial representation of the fracture. This is the tooth with 3 layers. The outer layer is the enamel, then dentine and the pulp. Root consists of cementum, dentine and the pulp. So as you can see in this picture, when the trauma involves only the outer surface of the tooth, that is enamel, it is class 1 fracture. Whereas if the traumatic injuries involved enamel and the second layer, that is dentine, it is class 2, where there is no involvement of the pulp, so the pulp therapy is not indicated. Then if the traumatic injuries involve enamel, dentine and the innermost layer, that is pulp, then it is class 3 fracture, where any kind of pulp therapy is indicated. Then in case of class 4 fracture, because of trauma, the tooth become non-vital. Class 5 fracture is where the tooth is lost because of the direct injuries to the tooth, known as avulsion. Then class 6 fracture is when there is fracture of the root fragment. Class 7 is displacement of the tooth without fracture of any part. It is most common in the primary dentition. Then class 8 is fracture of crown in mass and replacement, where there is complete fracture of the crown. Then class 9 is when there is injuries to the primary dentition without involving the permanent dentition. It is class 9. So coming to the mechanism of the dental injuries, as we know, the dental injuries are very common. So the injuries can be because of the direct trauma, direct impact on the tooth, and indirect trauma, where the trauma is on the indirect object, like the trauma in the mandible leads to the clenching of the mandible on the maxillary teeth, leads to the trauma in maxillary teeth. So it is a type of indirect trauma. Now coming to the examination in case of traumatic or dental injuries, it can be done in 4 phases. Like first, the extraoral examination will be done, then the intraoral examination will be done, and then the mobility of the bone and the tooth will be checked, and then the alignment of the jaw and the teeth. Now coming to the diagnosis part, the diagnosis should be done step by step. First, the history should be taken. Before starting the treatment, the patient name, age, sex, address and telephone number should be mentioned. It is mandatory before starting any kind of treatment. Then the second thing is when the injury occurred, the time period. Then where did the injury occur? Because it is important for the tetanus prophylaxis. Then how did the injury occur? The impact of the force is also important. And then whether the patient is taken any treatment elsewhere or the primary treatment, it should be mentioned. Then history of the previous dental injuries is very important, whether the patient was prone to the injury. Then the general health of the patient, because the general health also impact the oral health. Then take the history that patient during the injury, if the patient had drowsiness, vomiting and headache, which represent the traumatic injuries to the skull. Then whether the patient is having spontaneous pain or when there is, or if there is tender on percussion, or if there is a disturbed bite or any kind of disturbance in the occlusion. Then do the extraoral examination. Check all the type of scars, marks and injuries by palpating the extraoral surface to rule out the facial injuries or the facial fracture. Inspect the area carefully to rule out any kind of injuries to the extraoral surface. Then the intraoral injuries. Check the hard tissue and the soft tissue as well. Gingiva, tooth, PDL, alveolar bone should be checked. Inspect the individual tooth one by one. Whether any kind of crown fracture is there, whether there is displacement of the tooth, or whether there is loss of tooth or avulsion. In case of avulsion, do the chest x-ray to rule out whether the avulsed tooth or the lost tooth is in the chest or in the stomach. So do the ultrasound of abdomen if you cannot find the lost tooth. And then reaction of the pulpal testing, pulpal status of the tooth, whether the tooth is live or the dead, and then do the treatment accordingly.